A very good morning to all the doctors and everybody who have joined the webinar today. It's a pleasure for us to have you all here. This is Dr. Shivangi and I feel very fortunate that I've gotten this opportunity to present the topic, a case presentation on Parkinson disease with radar opus. And I'm very thankful to the BGNRX and BGN publication for giving me this opportunity to represent this topic in front of you all today. So before I begin today's case presentation, I would like to give a short introduction to Parkinson disease. So let's begin with the introduction part. Parkinson disease is a condition where a part of your brain deteriorates, causing more severe symptoms over time. While this condition is best known for how it affects muscle control, balance, and movement, it can also cause a wide range of other effects on your senses, thinking ability, mental health, and more. I'm going to the next slide. A progressive disorder that affects the nervous system and the part of the body controlled by the nerves. Symptoms start slowly. The first symptom may be barely noticeable. Tremor in just one hand, tremors are common, but the disorder may also cause a stiffness or slowing of movements. Symptoms often begin on one side of the body and usually remain worse on that side even after symptoms begin to affect the limbs on both sides. The next slide on some early signs of Parkinson disease may include movement changes such as tremors, coordination and balance impairment that can cause a person to drop things or fall over, a loss of senses of smell, gait changes, so a person leans forward slightly or shuffles when walking. Fixed facial expression due to changes in the nerves that control facial muscles. A voice tremor or softer voice. More cramped and smaller handwriting. Sleep problem resulting from restless legs and other factor. Rapid eye movement, sleep disorder may be a powerful predictor. So the other symptoms includes mood changes including depression, difficulty chewing and swallowing, fatigue, constipation, skin problems, dementia, delusions and hallucination that can develop in time. So this was all about the sign and symptom. I'm going to the next slide, that is the risk factors. So the risk factor includes past traumatic brain injury, trusted source like head injuries from contact sports, for example, may increase the risk of the condition. Toxin exposures. In toxin exposures such as pesticides, solvents, metal and other pollutants. So ongoing exposure to herbicides, pesticides may slightly increase your risk of Parkinson disease. Now the next one is gender. Male are 50% more likely to develop the condition than female. Although one 2016 study suggests the risk for female may increase with age. The next factor is age. The condition often appear from the ages of 60 years. The next factor is some drugs and medication. Like certain medicines can lead to Parkinson's where a person have tremors and other symptom but does not have Parkinson disease. So this was all about the risk factors. So this was a very short introduction on Parkinson disease. Now I'm going with my case presentation. Now the case illustration. A female patient of age 62 years reported at my clinic with the chief complaints of abnormal rhythmic movement of upper and lower limbs since 3 years. It started on the distal part of both upper limbs simultaneously with the stiffness of the upper limbs. The hands used to tremble while writing, difficulty in walking in the form of difficulty in initiation. And once she start walking, she stoops forward with small and fast steps and marked traveling of both the feet, unsteadiness of legs during walk, and it is difficult to her walk without support. The patient has a tendency to fall backward with dizziness. This is a marked symptom of my patient. The patient has a tendency to fall backward every time with dizziness and vertigo. Now I'm going to the next slide. History of present illness. The present complaints. Patient was apparently well 3 years back. 3 years back, she had chikungunya fever. Along with it, she became very weak and started feeling tremors in hand and feet. The hands used to tremble while writing. Whenever the patient start walking, she start feeling dizzy, due to which she leans backward and she has difficulty in swallowing, even while eating, whether it is liquid or food, with loss of facial expression. Marked stiffness can be seen in the upper and lower limbs with restricted movements. She is worried about her health and she become very forgetful. But uh, in her sleep, she remembers all that she had forgotten. So this is also a very marked symptom of my patient, that she become very forgetful, but in her sleep she remembers all that she had forgotten. I'm going to the next slide. Past history. Patient at the age of 17 years had intermittent asthma attacks, which was cured after taking homeopathic treatment. The family history: mother was hypertensive, father was diabetic. She has two younger siblings who are healthy and alive. Now, the mental journals. So in today's case, we are focusing on the mentals. So the mental journals are here. She is worried about her health and disease. She becomes very forgetful, but in her sleep, she remembers all that she had forgotten. She can't tolerate contradiction and get angry easily. She refused to answer. The next symptom: she always longs for company. She was averse to solitude. And the last symptom of my patient is weakness of memory. So this symptom is very common in Parkinson disease, the weakness of memory. Now I'm going to the next slide, that is physical journals. The thermal reaction: patient is ambithermal, appetite reduced, declination to eat generally, taste, desire for spicy food, thirst, unquenchable thirst. The patient has unquenchable thirst. Urine, normal maturation. Stool, hard, constipated with ineffectual urging. Sleep, the patient did not feel refreshed in morning. Dreams. So this we already discussed in the previous slide. The things which she could not remember in her daily routine, she used to remember them in her dreams. So this was all about my case presentation. So thank you so much for staying with us. We will starting the presentation and training. How can we reporterize this case with the help of Radar Opus? So I will be sharing my screen to all of you. So everyone, this is Dr. Shivangi Singh and I will be demonstrating you all about how you can get started with Radar Opus and how can we reporterize the case with the help of any repertory in the radar. So before I start, let me explain to our viewers how this interface works. On the right hand side panel of your screen, you have a short chat box. So you may type your query or whatever message you have right there and press button next to it to send it to us. Now I'm going to start my presentation on radar. So whenever you open your Radar Opus software, it will open exactly like this on your main document screen. So whenever you open Radar Opus software, you will get one repository open by default. So this time we have synthesis Adonis repository here. So whenever you open the software, you'll get one repository by default. It's either any repository like Ken, BBCR, FATAC, Murphy, or BTPP, but this time we have Adonis here. The above icons are known as icon bar or toolbar. These all icons are known as icon bar or toolbar. And these five icons which are present on the left hand side of your screen are known as primary icons. So primary icons consist of repertories, references, patient management, remedies, and families. So before I start with my case presentation, I would like to give you a very short introduction of these five primary icons. The first one is repertories icon. If you click on this repertories icon, you will get all the list of repertories in this table of content. So radar comes with more than 30 plus repertories, including synthesis. The second icon is references. If you click on this references icon, you will get all the reference material of RadarOpus software. So in the radar, we have more than 1600 plus source material in the references section. The third icon is patient management. With the help of this icon, you can take the history of the patient, you can make the prescription, you can type the consultation. So with the help of this third icon, patient management icon, the fourth one is remedies icon. If you click on this remedies icon, you will get all the list of remedies in this table of content. This index is basically known as table of content. So in this table of content, we have all the remedies here. They all are arranged alphabetically. So you can search your remedy by scrolling with the help of this scroll bar. Else you can search with the help of the search bar. Look for remedies. The fifth icon is families. If you click on this families icon, you'll get all the list of families in this table of content. They all are arranged alphabetically. So you can search your families by scrolling with the help of this scroll bar, else you can search with the help of this search bar. So this was all about these five primary icons. This was a very short overview of these five primary icons. Now I'm going to start my presentation, my case reportization. So for reportization, I'll start from the beginning. So for reportization, first of all, I'm going to the repertories icon. If you click on this icon, you will get list of all repertories. As I told you, radar comes with more than 30 plus repertories, including synthesis. So today I'm going to do my repertorization from synthesis Adonis repertory. Synthesis Adonis repertory is a successor version of synthesis treasure edition. Just below the Adonis, we have synthesis treasure edition. So synthesis Adonis is the latest repertory of today's era. So as comparison to treasure edition, the number of rubrics and remedies have been increased in the synthesis Adonis repertory. In Adonis, there are a lot of new provings, due to which we have many new rubrics and remedies. In Adonis, we have veterinary rubrics, clinical provings, pathological rubrics, COVID-19 rubrics. So Adonis come after the 12 years of treasure edition. So it's very understood that in the leap of 12 years, we have so many provings in the Adonis. Now my Adonis have open on my main document screen. Now I'm going to do my reportization from this repertory because this repertory is the latest one. So for reportization, I will be needing few icons. The first one is this binocular find rubric. If you click on this binocular, you'll get this navigation window. In this navigation window, we have all the chapters that belongs to this particular repertory. So the first symptom of my patient that I'm going to take, she become very forgetful, but in her sleep she remember all that she had forgotten. So it means this was a basically this was a very clear symptom of my patient, which she told me at the time of taking the case. The things which she could not remember in her daily routine, she used to remember them in her sleep or in her dreams. So this is a mental symptom. That's why I'm going to the mind chapter. So if you click on this mind chapter, you'll get all the rubrics that comes under this particular mind chapter. They all are arranged alphabetically. So you can search your rubrics by scrolling like this. Else you can search with the help of the search bar. Start typing the first letter of the rubric you wish to see. In front of this search bar, start typing your symptom or your rubric. Now the symptom of my patient is forgetful. So I'm typing here forget. Only 3-4 letters are required. Rest of the rubric you'll get below. Forgetful. Sleep. He remembers all he had forgotten during. Just click on it. Now my rubric have opened on my main document screen from mind chapter forgetful. Sleep he remembers all he had forgotten during. Now we have multiple clipboards here. These clipboards are just like our repertorial sheet. For doing the repertorization, we have to add this rubric into the clipboard and it will automatically get repertorized. For taking any rubric into the clipboard, we have three methods. The first method is drag and drop. With the help of your cursor, you can drag it and drop it. So this was all about the first method. The next two method I'm going to tell you with my subsequent rubrics. The next symptom I'm going to take, she can't tolerate contradiction and get angry easily. So the patient start getting angry on small things. So this symptom is also a mental symptom. That's why I'm going to the mind chapter. And I'm typing here contradiction. Only 3-4 letters. Rest of the rubric we will get below. Contradiction. Intolerant of contradiction. Just click on it. Now press enter button. After pressing the enter button, your rubric have open on your main would open on your main document screen. From mind chapter, my rubric is here. From mind chapter, contradiction is my rubric. Intolerant of contradiction is my sub rubric. Now I'm going to add this second rubric into the clipboard with the help of second method, and my second method is plus button on my keyboard. As soon as you press the plus button, your rubric is added to the clipboard. You can see here. The next symptom of my patient is she's worried about her health and disease. The patient is very worried about her health and illness. She feels that she should get well soon. So this symptom is also a mental symptom. Again, I'm going to the mind chapter and I'm typing here anxiety. Anxiety. Health about own health once. Now press enter button. Now my rubric is here on my main document screen from mind chapter anxiety. Health about own health once. Now I'm going to add this third rubric into the clipboard with the help of third method. And my third method is this icon. Take the current rubric icon next to this binocular. As soon as you clicked on this, your rubric is added to the clipboard. You can see here. The next symptom I'm going to take, she refused to answer anything due to her illness. So basically, due to her illness, she did not consider it necessary to answer any question. And when I took her case taking in my clinic, so her attendant answered all the question. She refused to answer me. So I'm going to the mind chapter. I'm typing here answering. Only 3-4 letters. Rubric is here, answering, refusing to answer. Now my rubric have open on my main document screen from mind chapter answering, refusing to answer. Now I'm going to add this rubric into the clipboard with the help of first method. Again, now my first method is dragging and dropping. With the help of your cursor, you can drag it and drop it. The next symptom I'm going to take, she always longs for company and she was averse to solitude. Because of her illness, she feels very lonely and feels that there's someone around her all the time. So for this rubric, company desire, I'm going to the mind chapter because it is a mental rubric. I'm going to type here company, only 3-4 letters. Rubric is here, desire for. Now press enter button. After pressing the enter button, your rubric would open on your main document screen. Now my rubric is here basically from mind chapter. Company is my rubric. Desire for is my sub rubric. Now I'm going to add this rubric into the clipboard. with the help of second method. As I told you, my second method is plus button on my keyboard. As soon as you pressed the plus button, your rubric is added to the clipboard. The next symptom I'm going to take, the patient is having weakness of memory. So weakness of memory was also seen. She can't remember most of the things. So for the symptom, I'm going to the mind chapter again. So in this case presentation, we are taking most of the mental symptoms. Okay, because I'm presenting a mental disease, Parkinson disease. So the next symptom is patient is having weakness of memory. So I'm going again to, and when I'm going to the mind chapter and I'm typing here memory, loss of memory. Now press enter button. After pressing the enter button, your rubric is open to would open on your main document screen from mind chapter, memory, loss of memory. Now I'm going to add this rubric into the clipboard with the help of third method, and my third method is this icon. Take the current rubric icon next to this binocular. So as soon as I clicked on this, my rubric is added to the clipboard. Now the next symptom of my patient that I'm going to take, patient has a tendency to fall backward with dizziness and vertigo. So basically, patient has fallen many times due to her illness, but whenever she falls on her back only, due to which she gets hurt a lot, and always a problem of dizziness and vertigo arises. So for the symptom, I'm going to the vertigo chapter, vertigo, and I'm typing here fall, tendency to backward only. Now press enter button. My rubric have opened on my main document screen from vertigo chapter, fall tendency to backward. Now I'm going to add this rubric into the clipboard with the help of my first method, and my first method is dragging and dropping. The next symptom I'm going to take, she has difficulty in swallowing even while eating, whether it is liquid or food. Because of this, she can't because of this she can't eat properly. She eats very little food, and due to eating less food, she loses her weight constantly. So for this symptom, I'm going to the throat chapter. Now I'm typing here swallowing difficult. Now press enter button. My rubric have open on my main document screen from throat chapter, swallowing difficult. Now I'm going to add this rubric into the clipboard with the help of second method, and my second method is plus button on my keyboard. As soon as I pressed the plus button, my rubric is added to the clipboard. The next symptom I'm going to take, the next symptom of my patient is her hands used to tremble while writing. This was the first symptom of my patient that she noticed during the illness, that she started having difficulty in writing. So I'm going to the extremities chapter for the symptom, extremities chapter. I'm not typing here trembling, hands, writing, aggravation. Now press enter button. Now my rubric have open on my main document screen from extremities chapter, trembling, hands, writing, aggravation. Now I'm going to add this rubric into the clipboard with the help of third method, and my third method is this icon, tick the current rubric icon. So as soon as I clicked on this, my rubric is added to the clipboard. So now there are two scenarios in front of us. The first one, when we know in which chapter we will get our rubric. So first we go to this navigation window and start searching our symptoms or our rubrics from these particular chapters one by one. And the second scenario, when we are not sure in which chapter we will get our rubric, or in our clinic we have patients, so we want to do the quick search. So for quick search option in our software, we have two type of search engines: basic search or advanced search. The next symptom of my patient, I'm going to search with the help of these particular two search engines. So the first one is basic search. Type in English. This search bar is for basic search. The next symptom I'm going to take, the patient has marked stiffness in the upper limbs. The patient has severe stiffness in the upper limbs, so due to which she was not able to perform any of her regular activities comfortably. So for this symptom, I'm going to type here stiffness upper limb. Just write down in a layman language in this search engine and you will get your rubric. Let me switch in the repertories part. Wait. Now my rubric have open on my main document screen. From extremities chapter is stiffness upper limbs. There are many rubrics like right, left, morning, evening, accompanied by heaviness, cold aggravation, morning. Now my rubric have open from Adonis repertory because I'm doing my repertorization from that repertory. So I'm going to add this rubric. From extremities chapter, it's stiffness upper limb. I'm going to add this rubric into the clipboard with the help of my first method, that is dragging and dropping. So this was all about the basic search. This search bar is for basic search. The next search engine is advanced search. Now moving to the advanced search, we have the search icon in the icon bar or toolbar. The next symptoms I'm going to search with the help of advanced search. So we have the search icon in the icon bar or toolbar. Click on this drop down next to the search icon. You'll get this advanced search option. Click on it. Now my advanced search have opened on my main document screen. We have four search bar here with four different headings. So with the help of this first search bar, search word in English, you can search any chapter, pathology, rubric, symptom, word, anything that you want to search, you can search with the help of this first one. The next symptom of my patient is having trembling of both the feet due to which she can't walk by her own without support. Her attendant told me this. The patient was always needs support while walking, otherwise she falls. Now I'm going to search this symptom. Now I'm typing here trembling. Rambling. So in advanced search, we have one simple rule, one word in one search bar. So after pressing the enter button two times, you'll get your next search bar. I'm repeating again, after pressing your enter button two times, you'll get the next search bar. Trembling feet. Now press enter button again two times. Now we have many rubrics here from extremities chapter. My rubric have opened from Adonis repertory by default. If you want to take this rubric from any other repertory, so in this list we have many repertory here, so you can take your rubric if you want from any other repertory. Now I'm going to take this rubric from extremities chapter, trembling feet. We have many other rubrics like left, morning, morning rising, aggravation, forenoon. I'm going to add this rubric into the clipboard, that is from extremities chapter, morning, trembling feet. Now I'm going to drag it and drop it. So the next symptom of my patient is tremor is more pronounced in the right hand. Due to excessive trembling of the right hand, she also had difficulty in writing because she used to write with the right hand only. So I'm going to take the next symptom. I'm typing here trembling. Just write down in a layman language and you'll get your rubric all the time. Trembling. As I told you, one word in one search bar. After pressing the enter button two times, you'll get the next search bar. Trembling hand. Right. Because the trembling is more pronounced in the right hand. Now we have single rubric here from Adonis repertory from extremities chapter, trembling hands right. Now I'm going to add this rubric into the clipboard with the help of first method. that is dragging and dropping. Now my rubric is added to the clipboard. The next symptom I'm going to take, let me close all these search bar. The next symptom I'm going to take, patient has unsteadiness of legs during walk. So for the symptom, I'm going to type here unsteadiness. One word in one search bar. In the next search bar, I'm going to type legs, unsteadiness of legs. And again, pressing enter button 2 times. Now my rubric have open on my main document screen from Adonis repertory by default. Now rubric, I'm going to take this rubric from extremities chapter unsteadiness legs. There are many rubrics here like afternoon, dancing while, walking aggravation, calves. But I'm going to take the first rubric because that is a symptom of my patient. The next symptom I'm going to pick. She has an unquenchable thirst. So for this unquenchable thirst, I'm typing here thirst. In the next search bar, I'm going to type unquenchable. You can search in a multiple letters, but the rule is one word in one search bar. Now my rubric have open on my main document screen from stomach chapter thirst unquenchable. My rubric have open from Adonis repertory. Now I'm going to add this first rubric into the clipboard with the help of dragging and dropping method. Now the last symptom I'm going to take. She is fond of spices and spicy food. She always desire for spices. So I'm typing here in simple letters spices desire. One word in one search bar. Now again I'm pressing the enter button 2 times. Now my rubric have open on my main document screen. There are three rubrics here from Junity's chapter food and drink, biscuits desire spiced, pickle desire spicy Indian pickles, food and drink spices desired. I'm going to add this third rubric into the clipboard that is from Junity's chapter food and drink spices desire. Now I'm going to drag it and drop it. So I've taken all the rubrics. Suppose you want to go to your analysis or your reportization, you want to see your reportorial sheet. So just click on your clipboard and you'll get your reportorial sheet on your main document screen. So wait. We have all the chapters here, rubrics and sub-rubrics. Now here we have the probable remedies as well as the grading accordingly. So we have taken all the 15 rubrics here. So sulfur cover all the 15 rubrics and the total is 25. If you add these number like 1 plus 1 plus 1, 3 plus 1, the addition is 25, will be 25. Natrum covered 12 rubrics out of 15 and the total is 17. So in the same scenario, you'll get your grading. So this was all about the reportization part. So if you want to read any remedy from your probable remedy list, so you can read it directly by double clicking on the name of the remedy. And the remedy will open on your main document screen as soon as you click on the name of the remedy. Like you want to read phosphorus from this list. So just double clicking and your phosphorus would open on your main document screen with a multimedia image. Now my phosphorus have open here. You can read your remedy by scrolling like this. Now I'm going back to my analysis. In this tab, my analysis remains open. I'm coming back to my analysis. So in the same scenario, you can read any remedy from your probable remedy list directly. So far I have told you how you can open any repertory and go to its navigation window and search your rubric or your symptom from the given chapters. And after that, I told you how you can search your rubric by search engines, in which the first one is basic search and the second one is in this tab, my search, advanced search remains open in this tab. the advanced search is here. So the second one is advanced search. Now I'm going back to my analysis. So this was all about the reportization part. Now again, I'm going to my slide. The last part is prescription. Now my prescription is here. The medicine I have prescribed sulfur 200 uh, in 7 globules, 8 hourly, followed by placebo. 34 pills TDS for 15 days was prescribed on first visit considering the repertorial totality. The patient improved symptomatically. The journal management I have given to my patient along with the homeopathic medicine. The patient was advised for complementary and supportive therapies such as diet, exercise, physical therapy and speech therapy. Patient was also advised for regular mild exercise for 35 to 40 minutes per day. So this was all about my first prescription. On the second follow-up, there has been a slight improvement in the trembling of hands and feet, and upper limbs stiffness and rigidity also decrease slightly with improvement in activities. So I have prescribed sulfur 200 single dose stat orally followed by placebo 5 pills, TDS 8 hourly for 10 days again. Then for the next 10 days, the journal management this time I have given to my patient. Lifestyle management can also contribute towards the treatment of paralysis agitans. The Parkinson disease is also known as paralysis agitans. Along with medicine, counseling was also done to calm the mental irritability and other complaints of the patient. In the third follow-up, journal amelioration in all symptom with marked reduction in trembling of upper and lower limbs. Now the hand trembles less while writing, due to which the patient has faith in the treatment and she is more confident and positive towards her medication and life. The symptom of falling backward are already improving. Now the difficulty in swallowing has also reduced. She can eat and drink water easily. So I have prescribed placebo 5 pills TDS for 7 days. Now this is a repertorial sheet of my patient case. You can see here. I would like to request all our viewers to comment in the chat box with their questions now. So we will begin the question answer session shortly. The first question I'm going to take. So learners want to know, is vertigo a sign or symptom of Parkinson? Yes, basically, this I already told my previous slides. Vertigo and dizziness are commonly reported symptom in people with Parkinson. Most experts basically agree that dizziness and vertigo can be broadly defined as a sensation of spinning or whirling, and the sensation can be associated with balance problem also. Now I'm going to take the next question from a viewer side is, severe headache are a main symptom of Parkinson disease? Basically, no. There are several common symptoms of Parkinson disease, though severe headache are not one of them, basically. Now, another question from a viewer side I'm going to take. How is Parkinson disease treated? Is there a cure? Basically, there is no known cure for Parkinson disease. There are treatment options that are available. Treatment for Parkinson disease is focused on managing the symptom instead of slowing or reversing the progression of the disease. And one more question. I think we have almost taken up all the question. So let's take the last one question from a viewer side is exercise helpful for Parkinson disease? Yes. This is very important. Basically, exercise can be helpful for managing the symptom of Parkinson disease, like such as stiffness and balance problem. So we have taken up all the question. I guess there are no more question I've seen here. So let's wind up here this presentation. So thank you everyone. I would like to thank all the viewers, the homeopathic fraternity who have joined us here today. Thank you so much. Have a great day. Keep learning, keep improving.